Hey everyone, in this video I wanted to talk about ways to improve your pelvic mobility and also how to lengthen your pelvic floor muscles and your glutes. So if you are struggling with sciatica, Piriformis syndrome, just feeling a lot of tightness in your glutes back here, having pain, pelvic pain, if you notice you're waddling while you're pregnant, all these things are going to help lengthen and create space in your pelvis. Basically just trying to unlock the pelvis, create more space, create some more elongation in those tissues. This video is also really good if you are wanting to learn how to prepare for birth and to really create space in this pelvic outlet to allow this pelvis to lengthen and create room for the baby to exit the birth canal. So we're going to talk a little bit about pelvic anatomy first. So here is my lovely pelvis. So I have the front of the pelvis here, and we notice that the top of the pelvis here is shown at the top, and we have the bottom of the pelvis right here. And you can also see that we have tons of muscles that are gonna be like our glutes. So we have like our glute max, our glute med. We have our deep hip rotators, which are really kind of like this. And these are really important because a lot of people with sciatica or piriformis syndrome actually have more tightness in the deep glutes, not really like glute max, glute med. So these deep glutes here really make up this kind of the pelvic outlet. So you can tell, or you can see if these muscles are really tight, you're going to see the pelvis kind of go like this. So you see that the top of the iliums, these bones here, they will kind of widen and you get this kind of cramping tightness part of the lower pelvis. So you'll see that you kind of walk like this. You'll notice that you might have lower back pain as well, because since your pelvis, which is supposed to move and be a mobile structure, since your pelvis is in this locked and tight position, you won't be able to move from your pelvis because your pelvis is basically locked up. So that's where we get issues like hip pain or back pain, because you're going to move above and below the level of restriction. So you think about it like this. If my elbow isn't moving well, like it's tight, then I'm going to compensate by moving more from my wrist or my shoulder. So same thing with the pelvis. The pelvis is the middleman. We have these pelvic joints right here. If these guys are stuck like this, then it's not going to be able to move that well, because our pelvis needs to move like this. I know this is kind of very exaggerated, but the pelvis needs to be able to rotate, needs to tilt forward and backward and like side shift. So if it can't do that, then you're going to move somewhere else. So again, if you are struggling with deep glute tightness, whether it's expressing itself as sciatica, piriformis syndrome, pelvic pain, tailbone pain, urinary leakage, then this video will be for you. So how can we release tension in our pelvic floor and our deep glutes? So again, here we have our pelvic model. How can we create more space so that we lengthen these muscles here? So that is the big question. And if you try some of these exercises, you'll notice that, wow, these muscles feel really tight. So here are some of my favorite massage balls. They are very squishy. So a lot of people think you'll need like a very hard ball, like a tennis ball or a lacrosse ball, to really release the muscles. But soft balls are ideally the best because it's going to help naturally lengthen, elongate, hydrate your tissues in a more calm way. It just will help down regulate your nervous system without creating more kind of scrunching feeling, or like, Because if you like massage your muscles with a really, really hard ball, it's not going to be comfortable. So you might actually be tightening the muscles rather than relaxing them. So that's why I love these soft balls. So one of the first techniques I'm going to show you is you're going to basically sit on the ball. So imagine this pelvis is sitting. You're going to put the ball on your sits bone, and then you're just going to massage the ball around your sits bone in clockwise and counterclockwise. And you have your hamstrings that attach to these sits bones. So if your hamstrings are tight, this is a really great option just to kind of open up that sits bone. So the first exercise we're going to do, again, I'll show it on my own body as well, is you're just going to do clockwise circles and counterclockwise. The next one we're going to have you do is, actually, let me demonstrate it first. So you're simply going to take the ball. You're going to put it underneath your sits bone. So it's underneath my sits bone. And then you're just going to do some circles clockwise and counterclockwise. And I always recommend just doing one at a time, because if you put both, the balls will kind of move around too much. And just really imagine just relaxing your glutes, softening them, not trying to hold your butt muscles tight. Okay, so I did about like 10 clockwise and 10 counterclockwise. So I just did one side, but that's how you would do these. So that's the first exercise of the series. The next one we're gonna do is you're gonna sit on the Franklin ball, and then you're just gonna let it kind of fall inside. So you don't want it to be at your tailbone. You don't want it to be at your sits bone. You want it to be in the middle. And you're just gonna let it kind of sit there. So there's all these muscles in here, 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 all these good stuff. And you want to put that ball right into here, because that's going to get your deep glute muscles and your posterior pelvic floor. So like your levator ani and those really deep muscles. Again, this is perfect for birth, especially because you want, the baby's going to come out of here. So you want all these muscles here to be able to elongate. That way you can prevent things like longer labor times, prevent excessive pushing, make it easier for the baby. You're just gonna kind of sit right here, and you're just gonna imagine your muscles melting over the ball. So again, we're gonna kind of be like so. I'm gonna put the ball under my sits bone first. I'm gonna let it fall inside of my sits bone, and you'll kind of feel like there's some, meat, some muscles in that region, and it might feel a little bit like, oh, that feels a little uncomfortable. If it's too uncomfortable, you can kind of prop yourself up more with your hands. But for mine, it's just mildly tight, and I'm just going to imagine like melting my muscles over the ball. You can even try and do some deep breathing. And you're just going to imagine like trying to create space in that muscle, trying to open up the muscle, improve circulation, oxygen to that tissue, and just let it kind of, relax and lengthen. So I typically recommend my patients do this for about 1 minute. And again, you're just sitting and relaxing. Good, so let's say I just did that for a minute. I'm going to kind of remove the ball and just kind of feel how it feels like between left and right. Like for me, my glute on my right side feels a little bit more open than my left. So that's the first one. That's the second one. The third one we're going to do is we're going to, again, start with the Franklin ball on our sits bone. We're going to allow it to fall inside to our deep glutes, and then we're going to roll the ball up and down, because we have glutes here, 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 all the way up the pelvis. So again, we're going to take it here and then roll it up and down. Feels really good. You can also kind of roll it up towards the sacrum as well if you're having a lot of like SI joint pain, which is really common during pregnancy as well. So again, first option is rolling kind of more outwards towards the glute. Next option is rolling more kind of like straight up along the sacrum line. So we'll do that one. So I'm going to put the ball under my sits bone first. I'm going to let it fall inside my sits bone, and I'm just going to roll up and down my glute. So I'm kind of rolling just straight, more kind of a diagonal outwards. And again, it all feels really, really tight. And then I'm going to help release my sacrum. So I'm going to go straight more up, a little bit towards midline to help relieve my sacroiliac joint. Again, you can kind of play around. So you can do different angles. You don't have to be like so restrictive, like I'm going to do 10 in one direction and 10 in the other direction. Just kind of like play around. You can even do like circles. I mean, right now I'm just really doing random, but yeah, really focus on releasing those glutes. Okay. All right, just see how that feels. My right side is definitely loosening up. So far those are three different exercises you can do. The last one I'm going to show you is more of like an active release technique. So basically what I'm going to have you do is you're going to again, first sit on the Franklin ball, let it fall inside into your glutes. You're going to keep it there as you move your pelvis side to side, or what we in this case called windshield wipers. So I'm going to put it here on my sits bone. I'm going to kind of let it fall inside and then roll it up my glute where it's tight, and then I'm going to do some windshield wipers. So maintaining that ball on the glute, I'm just going to drop my legs side to side. And again, it feels really, really good. You can even go side to side, because we didn't do that option yet. We only did like up and down the pelvis, which is a really great option. Good. So those are the active release techniques. That was the fourth one. And that's pretty much it for this video. So I would say spend at least a few minutes per exercise that I demonstrated. What can be helpful is to do work on the same side for all 4 exercises first, and then compare it to the other side and see what you feel. Like, see if you feel like it helped open up your glutes, maybe lengthen your pelvic floor, and so forth. So give these a try. Again, these are the Franklin method Pilates balls. I can link them down below. They are one of my favorite physical therapy tools. I pretty much use them all the time with my clients. So I highly recommend adding them to your recovery toolbox. They are about $30 on Amazon, so not too expensive, and they're very high quality. So as you notice, I was literally sitting on these and they didn't break. So they're very durable. I've had these for almost 2 years, and yeah, very durable. So again, let me know how that feels, and if you notice that you're waddling less, or you have less SI joint pain, less deep glute tension, let me know in the comments, and super excited to hear about that.